Tora Williams, a second-year resident and your host during the overview of the Family Medicine Residency Program at Navicent Health. Today, we're starting our tour in beautiful downtown Macon. Along the way, we'll look at some of the facilities on our campus and answer common questions that you may have, like what's unique about our program and what to expect from the rotations for first year to upper level resident. In a moment, you'll hear from our program director, who will give you a great introduction to our Family Medicine Residency Program. Then you'll hear more about the program from our department chair. I'll take you on a virtual tour of the facilities where you'll spend your time training, and you'll hear residents talk about our family medicine program and share their experience living, working, and training in Macon. I'm excited we're able to start our tour here in downtown Macon. I grew up in this beautiful community and I'm proud to call it home. Whether you enjoy good food, historic places, or fun events, you'll find plenty of opportunities to enjoy a great lifestyle here. So let's get started. As a resident, you'll be a part of Navicent Health's important mission of improving the healthcare of people and communities across Middle Georgia. You'll develop as a person and grow as a family medicine resident. You'll experience the full spectrum of family medicine with rotations ranging from peripartum care, obstetrics and pediatrics, to community medicine, general surgery, geriatrics, and more. I could say a lot more, but our program director is about to take the stage at Everso Auditorium. So let me hand you off to Dr. Monique Davis-Smith, who will give you a great introduction to the Family Medicine Residency Program at Navicent Health.
Thank you for joining us today. My name is Dr. Monique Davis-Smith, and I'm the director of the Family Medicine Residency Program at the Medical Center, Navicent Health. Whether you're familiar with the Navicent campus or this is your first opportunity to visit us in Macon, welcome. We are extremely proud of our program, and I'm thrilled to give you a glimpse of what makes it a fantastic training environment and a wonderful home to our family medicine residents. Our family medicine residency is community-based and sponsored by Navicent Health in affiliation with Mercer University School of Medicine. Our mission is to create a culture rich for training top-notch family medicine physicians while providing the highest quality medical care for our patients. Our faculty is diverse in gender, ethnicity, and interests, giving our residents experience across the full depth and breadth of family medicine. There are areas of interest in point-of-care ultrasound, women's health, geriatrics, and integrative medicine. Following the traditional 13 four-week block rotations of intern year, upper-level residents experience longitudinal rotations in medical and surgical subspecialties, women's and children's health, and community medicine. This allows residents to see patients, diagnosis, treatment, and follow-up in the course of one rotation as part of the normal sequence of patient care by referral physicians. Each resident receives a teaching appointment to Mercer University School of Medicine. They also have access to broad academic research opportunities and campus amenities. Overall, the Family Medicine Residency Program offers dynamic, integrated learning environment and curriculum that will fully prepare you to launch a career in family medicine. Our program is a 3-year residency with a challenging curriculum that maximizes practical family medicine practice experience with a focus on holistic care. Residents are taught to view and treat the patient holistically, incorporating psychosocial aspects of illness. We have a robust behavioral health division that enhances the care of our patients and addresses wellness for the residents. The residency program sponsors 2 fellowships, geriatrics and hospice palliative medicine. The family medicine residency spans the breadth and depth of holistic family medicine with a full inpatient and outpatient experience, also covering integrative medicine, ultrasound, geriatric and palliative medicine, addiction medicine, and medical-assisted therapy for opioid use disorders, and faculty development. We embrace the idea of creating healthy and nurturing training environment so physicians can serve the community through holistic family medicine by taking care of the whole patient, wherever they are along their continuum of care. The Medical Center has a stellar history of training family physicians. Since the inception of our residency program in 1972, we have trained over 300 family physicians, including a recent Surgeon General. Year after year, our residents enjoy postgraduate success with careers in traditional ambulatory practice, both as employed physicians and in private practice, and as hospitalists, telemedicine, VA, and urgent care physicians. The program has a track record with 100% take and pass rates on the ABFM exam. Several of our graduates have gone on to do fellowships in geriatrics, hospice palliative, sports medicine, emergency medicine, and academic medicine. We're proud of the fact that 60% of our graduates in recent years go on to practice in the state of Georgia, with nearly half of these residents choosing to practice in rural or underserved areas. While many of our colleagues choose to stay in Georgia, we have graduates living across the country. Across the years, I've seen how the success of a residency program depends upon having engaged leadership in the hospital and faculty. At Navicent Health and Mercer University School of Medicine, the enthusiasm to create a rich training environment does not stop within the program. It is integral to our mission. Now I'd like to introduce you to our department chair, Dr. Harry S. Struthers III.
Thank you, Dr. Davis-Smith. I'm Dr. Harry Struthers, Chair of Family Medicine for Navicent Health. I'd like to share some information with you about why I think we're an incredible place to do your residency. The number one reason to pick our program is that we're going to treat you like you're going to be our colleague. We try to recruit people who want to stay in Middle Georgia, and we know that if we treat you well, we have a better chance of keeping you here. Residents are part of us. We try to help them figure out what they want to do when they graduate so that we can tailor their education. We care about our students, we care about our patients. We want to make sure that our students get the best possible education to prepare them for their future. We have fun doing what we do. And so if you want to have a program that's not just work and education, but that you enjoy being there, you should pick us. And now I'm going to send you back to Dr. Davis-Smith.
Thank you, Dr. Struthers. As a family medicine resident, you'll truly be an integral part of the medical team at Navicent Health. It makes all the difference in the world when you have the program leadership standing behind you and 100% committed to preparing the next generation of physicians. A question you might have is, what do the inpatient and ambulatory facilities where our practice look like? To give you a closer look, Dr. Williams will continue your tour.
Thanks, Dr. Davis-Smith. Let's take a bird's eye view of the campus and a look inside some of the most important facilities to the family medicine program. Navicent Health is a large and comprehensive health system with over 1,000 beds, including 630 licensed beds at the Medical Center. Our newest and state-of-the-art facilities include the Peyton Anderson Cancer Center, Heart Institute, and the Beverly Knight Olson Children's Hospital. The Children's Hospital is one of Georgia's newest, most state-of-the-art pediatric hospitals and healthcare centers with 160,000 square feet and a strong reputation for excellence. As the region's only dedicated pediatric children's hospital, it houses its own pediatric surgery center, emergency center, and pediatric critical care, as well as neonatal intensive care units. The resident workroom in the Children's Hospital provides a place for table rounds where we discuss the status of patient cases, meetings with attendings, lectures, and working on notes. The main tower is home to our Family Birth Center, one of 5 regional perinatal centers in the state of Georgia, featuring spacious labor and delivery suites and peripartum rooms. On the East Tower's 2nd floor is the Hub, where our inpatient team meets for morning report and where we have educational sessions during the week. The TV room is where we present patients every Tuesday and Thursday mornings with residents and attendings. Here we can discuss the important patient cases, new admissions and discharges that will be following up at the Family Health Center. Interns and residents on the elective emergency rotation have the opportunity to train in our busy emergency center, where we have 2 trauma bays and a CT scanner. On the Heart Center's 2nd floor is the Family Medicine Resident Room, where we have our own workspace located on the main campus. The Peyton Anderson Health and Education Center houses our SIM labs, the library, and Trice Conference Room, as well as Eversole Auditorium. We typically train in the SIM lab once monthly, meeting regularly in conference spaces for grand rounds, morbidity and mortality, and robust didactic sessions. Our primary training facility is the Family Health Center, a Level 3 medical center about 5 miles from the main campus. The Family Health Center is where our residents see their continuity patients, have didactic learning sessions, become competent in several outpatient procedures, co-lead behavioral health sessions for their patients, and have the opportunity to participate in clinical research. The residents and core faculty practice side by side on teams, sharing the same facilities and patient population. In the Family Health Center, we have 3 procedure rooms, an on-site lab, on-site radiology, 40 spacious exam rooms, counseling rooms, individual resident offices, on-site gym facilities, a resident library, and state-of-the-art ultrasound simulators. Here our team can give EKGs, conduct home visits, provide therapy sessions, and perform minor skin surgeries, non-invasive vascular studies, colposcopies, immunizations, pulmonary tests, and exercise stress tests. I always knew I wanted to pursue medicine, even as a kid growing up right here in Macon, Georgia. To realize my passion of caring for vulnerable populations, both young and elderly, in the same town where I used to ride my bike has been incredibly rewarding. And while the road back home has felt long at times, the days have gone by incredibly quickly. A big reason is because of the great people traveling this road along with me here at Navicent Health. One of the best parts of my residency experience has been working in such a close-knit and supportive family of professionals, from fellow residents to faculty and staff. And while we're traveling different paths, we are joined together by our common goal to provide stellar care for our family medicine patients. Besides all that, most of them are actually pretty interesting people. Let me introduce you to some of my best friends and colleagues.
My name is Shannon Murray.
Michael Band.
I'm Latora Williams, family medicine resident.
Dr. Roberta Weintraub. Kathy Kimley. I'm a physician assistant in family medicine.
I'm from Jasper, Georgia.
I was originally born overseas in Germany.
Philadelphia.
I was born and raised here in Macon, Georgia.
I was very young when I realized I wanted to be a doctor.
I must have been approximately 7 years old.
I did a study abroad program where I worked at a hospital in Peru, and I really loved it, and I decided I wanted to be a human doctor instead of an animal doctor.
I wanted to take care of people just the way he took care of me.
I really like science fiction and fantasy novels.
Believe it or not, I enjoy scuba diving. I have an herb garden, jet ski,
Going on hikes, enjoying drinks and music with friends.
and lots of reading.
A word of advice for first day interns is continue to work hard.
So don't be afraid to ask questions,
Take a deep breath. Understand that you're not alone in this process.
because that's how you learn.
I graduated from medical school in 1994. The world has changed a great deal during that time. I'm super impressed by the energy, commitment, character, and talent I see reflected in our residents. They use their advocacy skills, show empathy, and think on a global level. Our residents are also culturally diverse, socially aware, and active in the community with volunteer work and extracurricular activities. Residents are actively engaged in Walk with a Doc and the Mentors Project with the Bibb County School District, addressing the growing problem of food insecurity in our community. As family medicine residents, they are well-rounded people who are teachable, mature, humane, and treat and meet our diverse patient population where they are. Our upper-level residents are always willing to guide and teach the other residents, and everyone works well together. Our culture is welcoming, friendly, and caring, and focused on providing outstanding clinical care that improves people's lives and the health across the continuum. We recognize these character traits are essential building blocks for the strong and vibrant team of physicians that make up our program. Over the years, we've seen many of these physicians move on to successful postgraduate careers. I'd like to introduce you to just a couple of them, Dr. Sarah Chuyik and Dr. Benji Ho.
One of my biggest joys about being a faculty member is being a teacher and a mentor to our residents. The exciting part of seeing a resident graduate from intern year to PGY 3 and onto their medical careers later on in life, that just brings me so much joy.
Does it bring back some memories?
It does. They're very recent memories since I graduated from the program in 2018. I'm Dr. Sarah Chuyik. I attended the Saba University School of Medicine and graduated from the Family Medicine residency at the Medical Center Navicent Health.
It's an honor to see the entire family. Now, going in, I thought I was already a compassionate person, but when you see a wide variety of patients, some are in very difficult situations, and you learn to treat them how you would treat any loved one or family member. I'm Dr. Benjamin Ho. I'm a graduate of the Family Medicine residency here at Navicent Health, and I am currently a family physician practicing in an outpatient clinic here in Macon, Georgia.
I chose to specialize in family medicine because it offers me the ability to see babies, adults, and seniors all in the same day.
I always enjoyed a smaller environment, being able to sit down, have more time with my patients, and I felt that private practice, outpatient, I was able to get that more.
Life in the family medicine department is very happy, outgoing. We have so many faculty members that are supportive.
Even though all of our attendings are family medicine physicians, they all have their own different interests, they all have their own expertise.
The greatest strength of the clinical environment is the fact that we have 50-50 outpatient as well as inpatient experience.
Our residency program, it really gives us a well-balanced education. We work in the ICU, we get the integrative medicine part of it as well, and deliver newborns. We get some emergency room experience. After we finish the program, we're very well prepared to do whatever is needed in our community. So 3 things I look for in a new resident is someone who can take pride in hard work,
Someone who's a hard worker,
can take criticism well,
dedicated to the field of medicine,
compassionate to other people.
just an overall team player.
I'm really happy with the path that I chose, and if I were to do it over again, I would.
100%. If I could go back, I would definitely choose the same path.
Our faculty, graduates, and staff often remind me of the impact that our program is having right here in Macon in the lives of our friends, neighbors, and families. We believe in our mission to create a rich culture for training top-notch family medicine physicians while providing stellar medical care to all of our patients. The Navicent Health Family Medicine Residency Program is made up of many team members, and it takes all of us working together to keep the program strong. We encourage each other every day to be better than we were the day before, and challenge each other to be our best selves. We are a program striving for excellence and looking for team members who want to continue growing, learning, and contributing to the improvement of their community. I hope you've enjoyed the brief introduction. Thank you for joining us today.
Well, that wraps up this introductory tour of the Family Medicine program. I sincerely hope you'll consider training here, where you'll have the joy of working in family medicine as a part of the Navicent Health residency family. On behalf of the entire team, we wish you the best as you make your decision.